Hi everyone, welcome to Pharmacology. So today we will discuss some more pharmacy exam multiple choice questions with their answers. So first question, an overdose victim presents to the emergency department with an elevated heart rate, decreased blood pressure, dilated pupils and lethargy. Upon arrival to the intensive care unit, she has a generalized tonic-clonic seizure that is treated with IV diazepam and fosphenytoin. Which of the following is the most likely intoxicant? Options are ethyl alcohol, methanol, acetaminophen, oxycodone, amitriptyline. Answer is option E, that is amitriptyline, which is a tricyclic antidepressant. Tricyclic antidepressant overdoses will produce seizures, hypotension, mydriasis, and ventricular dysrhythmias. The cardiac and CNS effects of tricyclic antidepressant toxicity will respond to bicarbonate therapy. Opiates such as oxycodone will produce meiosis. Parenteral products with an osmotic pressure less than that of blood or 0.9% sodium chloride are referred to as. Options are isotonic solutions, hypertonic solutions, hypotonic solutions, isoosmotic solutions, neutral solutions. Answer is option C, that is hypotonic solutions. Hypotonic solutions have an osmotic pressure less than that of blood or 0.9% saline, whereas hypertonic solutions have an osmotic pressure greater than that of blood, and isotonic or isoosmotic solutions have an osmotic pressure equal to that of blood. Aseptic technique should be used in the preparation of all of the following medications with the exception of. Options are neomycin irrigation solution, ganciclovir intraocular injection, phytonadione subcutaneous injection, ampicillin IV admixture piggyback, bacitracin ointment. Here the correct answer is option E, that is bacitracin ointment. Irrigation solutions, ophthalmic preparations and parenteral products and subcutaneous and IV medications should be prepared using aseptic technique. Because bacitracin ointment is applied to the skin and does not bypass the body's protective barriers, its preparation would not be held to the same requirements. Intra-articular injection refers to injection into the. Options are muscle mass, subcutaneous tissue, spinal fluid, superficial skin layer, joint space. Answer is option E, that is joint space. Intra-articular injection refers to an injection into the joint space. This administration route generally is used for certain types of corticosteroids to reduce inflammation associated with injury or rheumatoid arthritis. Advantages of the intravenous route include. Options are ease of removal of the dose, a depot effect, low incidence of phlebitis, rapid onset of action, a localized effect. Answer is option D, that is rapid onset of action. The intravenous route of drug administration allows for rapid onset of action and therefore immediate therapeutic effect. There can be no recall of the administered dose and phlebitis or inflammation of a vein can occur. In addition, a depot effect, which means accumulation and storage of the drug for distribution, cannot be achieved by administering a drug intravenously. Delivering a drug intravenously results in a systemic rather than a localized effect. So that's all for today. Thank you and have a nice day.